And welcome back. We're moving into our third segment for this lovely Thursday morning, which of course it is. We've got another nice topic to venture off into. Be safe, improving access to cancer care. Remember, early detection saves lives. Actually, Breast Cancer Awareness Month is here with us, of course. And in to tell us more about it, actually, we've got the president of the Belize Cancer Society, Laura Longworth, and of course, the chief executive officer, Dangriga Cancer Center. And it's so nice to meet you, Pascasio. Ladies, good morning. You're looking beautiful, and welcome.
Thank you. I think Ms. Delon got a sweeter smile.
I provide the smile to both of you.
We are well, thank you. We're very happy to be here this morning. Thank you.
Definitely, again, welcome. This is something that touches home for a lot of people. Reason being is because they have lost loved ones to cancer, to breast cancer, to be specific. It's definitely something that we talk about, not much about. People are actually afraid to eventually going out to do checks because they're so afraid of what the outcome will be, and so let's venture off into it. Early detection saves lives.
Yes, early detection does save lives, and nobody knows that better than my colleague at the Dangriga Cancer Center. But most importantly, I think that from a wellness perspective, we need to look at those things that keep us healthy. And I noticed that you had the Director of Health Services on a while ago, which was an excellent intro to the discussion on breast cancer. Since cancer is one of the NCDs, I think many people don't realize that cancer sits right in there with NCDs. We share quite a number of the common risk factors, whether you're speaking to diabetes, hypertension, cardiovascular disease, or otherwise. We have, and tobacco smoke is all across. Tobacco is cardiovascular, tobacco is cancer. And tobacco can do cancer from the mouth, cervix, lung, a number of places. So it was an excellent introduction, and I'm glad that he was in on that. But certainly breast cancer in particular continues to be a problem for women, and I noticed a conversation about obesity and the issue of the higher risks for breast cancer. And so that was interesting as well. But certainly the whole issue of breast cancer for all of us is a worrisome one, like other cancers. But women more than men have breast cancers. Men, maybe one here and there. I think I reviewed the statistics, and I think in the past 2 years we had 1 or 2 men diagnosed. Of course, when we speak to statistics as well, we have to be a little bit careful. We have to because many times the health information system captures only those that are reported in the public system. And so Ms. Pascasio Delon will be able to speak to what she's seeing in her area. But we think that the breast cancer, and what we try to do at the Cancer Society is to really raise that consciousness and awareness that you have to go looking. You have to go looking, and we will encourage people to take it as a health issue. Take a pilgrimage. Every year you go for your wellness check, but you have a clinical breast exam. You have a nurse or a physician examine your breast, because 60% of cancers can be detected quite well with clinical breast exams compared to the mammograms. 60%. So because you flatten out, and of course the clinicians knows best how to really examine. And of course we encourage our citizens to be aware of services that exist in Belize. We have clinics all over the place. We have primary health care clinics. So you can go in and create that demand and ask for your breast check. So those are the things that we want to share with the public, and also share that we have people being diagnosed newly every year. And the health information system for the Ministry of Health captured already for up to now 12 newly diagnosed cases right? And each year we have people dying from breast cancer, quite a number. And I don't like to give statistics, but it's upwards of 10 or so persons. So
A year.
yes. And so, and of course you have to compare these things to the population and all that kind of thing. And if we review the data for Central America, Belize is right in there, inching up because of our numbers. So
why is it that we are still seeing what is considered, any death is significant, but a significant number of deaths from breast cancer, even though it's considered to be a treatable form of cancer?
Well, I think part of that is because of the late diagnosis. Most individuals, a year before they even become concerned about, the change in their breast anatomy, they know something is not quite right. But people get busy, their lives get busy, they have to take care of the kids, they put this off, and they say, I'll take care of it later. And later becomes more extended. And by the time they begin to feel uncomfortable, they have pain, something is not quite right. You have maybe a fulminating, ulcer on your breast. Then they go into the healthcare provider and they ask for assistance. Most often, if diagnosed, it is late stage. And then you have to work even harder and find a different combination of medication to see if you cannot either arrest that process or shrink that tumor if possible, so then you can go on to neoadjuvant therapy, which would be surgery.
To 350,000 people in the country to hear 10 deaths a year due to breast cancer. At what age should we say that we should go in, men and women, to do breast checkups?
But those decisions is a personal, you have to check your personal family history. But usually it's recommended for 40, but I hasten to say that those guidelines are not guidelines developed for Belize based on our epidemiological profile. And so it is said that you go in after 40 and over, the scientists say that. But increasingly we encourage women to look at their family history. We do have people in their 30s increasingly presenting themselves for treatment, and of course finding them that they have breast cancer. So that we need to develop our own, and I'm sure Talon would agree with me, we need to develop our own profile. But in terms of mammograms, it's recommended also at 40 and above.
Why is it important to check your family history?
Because you have a higher risk, especially if you have mom, auntie, sister, right through. First of all, if you have cancer period, but your risk increases if you have a family member with breast cancer. And there's a pattern. Some families have a certain gene they carry. And so you'll find them with all the sisters and all the, having cancer. And some others, they would say, oh, yes, I have an aunt that died, or
my grandmother.
or my grandma. So it's very important to check the family history.
Now, the key message that we hear is, if you can find it early, your survival rate is so much better. In other words, if you physically find it, because if you start to see ulcers or if you start to see a lump, that's your body showing you. But you want to find it for yourself. And I know, in addition to speaking about perhaps considering a mammogram earlier, from an even younger age, we can start doing our own checks.
Correct.
Yes.
Absolutely.
And it would be really, really helpful as part of the education in school, particularly at the upper levels. As part of maybe a little health exercise to just show the children how to do a clinical breast exam, how to do a breast exam. The clinical breast exams are usually done by the healthcare provider.
Yeah.
But you know what your body looks like. Of
course.
You know when you feel changes in the body, particularly because these are external appendages, if you will. Okay,
Yes.
and you can see them.
Yeah.
So visual inspection along with the palpation
Yeah.
would probably be a very good step forward to teach everyone how to do that.
That's right.
And what are we looking for when you do a self-breast exam?
Just changes and the whole issue of flattening, because you have to flatten. And what we encourage people, don't lift your hands when you're doing an exam. You keep those fingers down and you snake across the breast so that you don't miss any spot.
Okay.
And then when you've done circular, you go and remember that there are breast tissues all the way under here. And the truth of the matter is, many times women discover
Something under their arm.
and then they say, but wait, that's where they find it rather than here. So you have to remember that the breast tissue is all under there. So that's what we have to look for. In terms of managing breast health in Belize, we have mammograms, we have physicians, we have clinicians who can really give you the kind of services you need in terms of detection.
Yeah.
And we also have surgeries that can be done in Belize. And then what next? If you're diagnosed, what else? What we do at the Cancer Society is navigate. We work with patients. When there's a pathology report coming out of the pathology, whether it's sent abroad in the private sector or sent to our local laboratories, and you get a diagnosis, then what? And so what we do at the Cancer Society is do a lot of counseling and encourage people to plan for the long haul, because cancer is not only devastating to the family and to the individual, but it's also a catastrophic event.
Yes.
Because it's time from work, and it's also time from the family, and it's also money.
Yeah.
So right.
And
so,
all the fears that
and all,
manifest
everything
in the
else.
family.
And of course,
the
it's your
key.
body image disturbance. You have to lose a breast. Many women still make that decision not to remove that breast. And so you have to find other ways of treatment for them, because it is a personal decision. You have to be engaged in your own decisions. You have to be informed, and you make a conscious decision about your health based on the scientists and the scientific data that's available and the clinician that you have.
Yeah.
That's how the family makes that decision. The next step then would be to, after counseling and speaking to the family and so on, the Dangriga Cancer Center is the next point of referral, apart from those persons who also know that if they have the resources, they can seek treatment wherever they want to go. But for our population, and we have a cross-section of the population coming for treatment at the Cancer Center in Dangriga, because we've had many patients passing through, and also because it's in country.
Yeah.
You're
And you
close to
can
your
be closer to your
family,
family.
which is amazing. You have family support, you have nutritional support, you have emotional support, a friend somewhere to hug you and hold your hand, give you a call. So we love that very much. And so when the patient gets to Ms. Delone, she can tell you a little bit more about what their challenges are at the Dangriga Cancer Center. And they're quite a bit.
You're in your 7th, 8th year?
Yeah, we opened in October of 2008.
Yeah, yeah.
So we're sliding into our ninth year.
Yeah.
Yes. And actually, so far, I was just looking at the data base yesterday, and we've seen a little bit more than 1,500 patients.
Wow.
It's just doesn't, because it's so spread out, it doesn't seem that much. Right now, we're following about 64 active patients.
Okay.
Active meaning they're actually getting treatment at the Cancer Center. And interestingly enough, about 39% of those are from Belize City,
Wow.
which is the largest percentage for us.
That's right.
The next largest is from Stan Creek, which is 18%. So there's quite a bit of a gap between, you know, the districts and the location of where the patients are coming from in terms of cancer. Breast cancer is still, breast and cervical cancer are still the two largest diagnoses that we have, that we see in the pharmacy, I mean in the cancer center. And then, of course, you have
And at what stage do you normally see them?
various stages.
Yeah.
You know, we like to see them early. Stage 2, you know, 1B, stage 2. But unfortunately, many times we see them 3, which makes it even more difficult to control the disease and put it in that box. And sometimes it doesn't, and sometimes it does, based upon, you know, at what stage we find. Or challenges to get a good turnaround on the pathology reports so that we are able to identify a good treatment plan for the patients. And we're working with the Ministry of Health right now on improving that turnaround time.
Yeah.
Excellent. What I wanted to, because you know, every year we talk about it, and every year we celebrate Breast Cancer Awareness Month. And you did mention, Diane Delone, that we have seen, especially in the Belize area, Belize district area, 39%, which is of course an alarming rate. And over the amount of years, have we seen a rise of people flocking to the cancer center? And what year would that be? Are we seeing that right now? Important because we talk about it and people are so afraid to go in to do these checkups. So because we're talking about it now and people are taking heed, are we seeing a lot of people going over there?
We're seeing more than we generally, and it's an increasing trend.
Yeah.
You know, we get I would say a week we might get 3 or 4 new referrals.
Every week.
Every week?
Yeah, 3 or 4 new referrals, and we are talking about confirmed cases because we see them after the pathology report has confirmed.
After they've been diagnosed.
Yes, that they have this disease. So that is unusual in itself. But in a sense, no, because it just means that people are going into their providers more often, and they're being, you know, being diagnosed earlier. What they do with that information, what we're finding out is really quirky. They sometimes get the information, they sit on it, it percolates. They have a difficult time trying to make a decision about what they want to do next. And when they start getting really sick,
That's when they come.
then they come, because then they're ready. And there we have, well, you know, for us, emotional support is very significant.
Yeah.
You know, we also deal with what we call diagnosis depression.
Yeah.
You know, you find this out, this is terrible. You're thinking
You feel
about
like you're seeing the end of your life. I
Exactly,
imagine.
exactly.
Yeah. Yes.
You're thinking about the children, you're thinking about the rest of your family. More importantly, you're thinking about, I don't have the money to take this treatment.
Yeah.
You know, which is where we come in. You know, we.
Well, I was going to get there.
Oh, I'm sorry.
No, it's very important for us to talk about, because I think while people will willingly wear pink or a pin, they don't understand that we need to do a little, or a hashtag. Like, it's not enough. There are resources that are needed to be able to treat cancer, and the Belize Cancer Society has worked with assisting in diagnosis, and the Belize Cancer Center has continuously, going on 9 years, been providing services, treatments. How many people can afford from the diagnosis to the treatment? What is the reality that we're seeing in Belize?
Well, if we talk about affordability, that's a $1 million question. Because
Is it more like millions of dollars? Yeah.
And I say that only because it is very, very difficult for families to even fathom the cost of drugs. I'll give you, for instance, there's a drug called Keytruda. Keytruda is a kind of a third-line drug that they use for small cell carcinoma of the lungs. The cost of one Keytruda intravenous injection is over $2,000 US.
Wow.
And more than likely, this individual might need, 6, 7, 8, 10 treatments. So you have a discussion, you outline basically what is available. The families will decide, what they want to do. Fortunately, for Dr. Grant and his ingenious way of getting medication, we would.
You still have donations.
We have donated. He actually has a drug bank that he put online, and individuals who have these will donate to the drug bank, and we in turn can donate that to the patients.
Yes.
So I just had a review, and we had a gentleman who has prostate cancer. We have provided about $63,000 worth of charitable care for him, because that's the medication he needs. That's the one that's going to help him to get back to where he needs to, and we have it because it was donated. So we just donate to him.
Delon, can we clarify the situation here? Because I think there are two schools of thought. People think, one, you get free treatment at the Belize Cancer Center, and some people think that they won't go because they'll cost too much.
Yeah.
What is the balance that the Cancer Center has struck in terms of being able, you have your expenses.
True.
And there's always a need for more medication, and some people perhaps need more unique medication than what you have available. How do you work with patients when they come in about being able to afford the care that they need?
See, we operate on a contribute as you can basis.
Okay.
So, we get the medication. The medications, we get them from everywhere.
Yeah.
In the U.S. We have vendors that would like to share. We get, we have a foundation in Los Angeles, and the foundation purchased medication at below the manufacturer's price.
Okay.
Not certainly, if we couldn't do it at the retail price. But when the patients come in and they're already very concerned, we would sit down and we would say, here are the options after we've had a consultation with the oncologist. And generally, a lot of the diagnosis or the types of cancers can be treated with your basic drugs, your first line drugs, and those are very, very inexpensive. Some of the like the 5-FU and the carboplatin, these things are very, very low in cost. $4 here. In comparison, if you went out on the market and you try to buy them, they would be significantly more. But there's no. For us, we get the drug at that cost. We give it to the patient at that cost. But we'd have that discussion with the patient, and we will say, how much do you think you can contribute to your care?
Yeah.
If they can't, they can't. It doesn't mean that you're going to not get care, because that's not our mission.
Yeah.
Our mission is to provide care.
Of course.
Okay, we have to find other ways, as you say before, of funding the drug cost. And that's why we are looking at, if you know a good grant writer, we would love to talk to him or her. So because that's essentially how we would like to be able to fund it. We would like to be able to get to the point where, and in a relationship with the Ministry of Health, where they actually have a line item on their budget for cancer care. And that is where our policymaker and Speaker of the House comes in.
You have any closer?
I figured she was going to come back.
It is still, and I recall when the center first opened, that was the mission Dr. Grant and yourself had coming in, offering this care and treatment free of cost to Belizeans, because there was nowhere they could get treated for cancer. And you renovated your own family home to be able to do it. But at this point, with the numbers that you're seeing, I'm sure it gets challenging.
It does. And we were fortunate in a partnership with the Social Security Board and with the Belize Cancer Society that we received funding for our patients going out to Guatemala City for radiation, which is that last part of the treatment plan after chemotherapy. And I would say that the Social Security Board continues to be very, very sensitive to our need and to work with us as great partners. That's not sustaining over time. We have to find a better way of being able to embed cancer care in the overall continuum of care for health.
Definitely.
So that, as in most other countries, it becomes inclusive as opposed to segregated to, another entity.
Yeah.
Yeah.
So that's kind of where our
Yeah.
vision is, Laura's and mine.
Yeah, and it just takes me back because the whole issue of the gold standard for cancer care has to include chemotherapy and radiation therapy. You've got to have that in your whole slew of services that you provide. The country where we are at this point, we know that we cannot offer radiation.
Yeah.
Right now, the plan has to be but we have to start planning for it between 5 to 10 years' time. I visited Nicaragua. They have an amazing radiation center with support. And there are agencies abroad, internationally, the Atomic Energy Group and certain donors that would provide linear accelerators and so on. But my point is this, the issue of cancer, we have to understand that by 2030 we'll have a dramatic increase. We are seeing it now. We must decide as a nation what we want for our people. We have a right to health services. We have a right to receive the care, appropriate care for the condition that we have. Not elaborate care, not heart transplants, at least not at this point.
But the low-hanging fruit.
But cancer,
Effective care.
we've got to provide. As a country, we need to provide for our people. And so our conversations continue to be with the Ministry of Health, is what and how do we pay for cancer care for patients.
What has the lobbying effort been like so far?
It's been very good. We have, the Ministry of Health, the CEO in particular, is very, he has a public health perspective, so immediately you're on the same track with him. He's there with you. And we have other, for instance, Mrs. Burrows, a champion, working over the past year, for instance, with her efforts. She has brought in the atomic energy people. They've come in, they've looked at the cancer center in Dangriga. The idea is that they want to help us to find resources to build a new center.
Wow.
Yeah, and not only a center, but where you can have some preventative services available as well as treatment, and help the country to work towards radiation. We as a country have to work with the global community because there's a global outcry. People should not be dying prematurely because they lack access to services.
That's
and
right.
countries like ours, with our poverty rate at a certain, being 42, 43%, and other countries like ours in the Caribbean and other places, we all have to move quickly to take care of our people.
There's so many angles you worked on. One, get people screened, detect early, treat early, which is a cheaper treatment as well. Prevent it altogether by getting healthier, affording diagnostics within the country as well.
There you go.
Because I know that's where the Cancer Society raised their funds to. They can't help with the treatment. And it's difficult because I know you put a strain on another
On
center.
that service, yes.
But I cannot fathom being diagnosed or being told I may potentially have cancer and not being able to afford to find out anything else beyond that, mentally what it would do.
It's unethical, actually.
Yeah, or being
For you
given
not
a
to be given,
diagnosis and not being able to treat.
Right.
So it is, and all of these different steps, minus the preventative, are expensive. So it's almost trying to figure out where the resources should go.
And the thing is, do it well, and you have to do it across the spectrum. In other words, you have to have a country plan, a big country plan. We have to cost those plans, cost those services, and phase them in. And we have made progress with cervical cancer. We have finally completed the entire spectrum of care. And we want to do a big shout out to
HPV
Dr.
vaccine.
Larga Espada-Bear in the Ministry of Health, and all our social partners and others who have worked with us on the committee to get that done.
And the parents who
Right.
said yes as
And,
well.
and the parents who are
said
saying
absolutely.
yes. There's a great story on the HPV launch where Dr. Bear informs us that for those persons who are eligible, there's like a 52 or 54% uptake already, and it's not even a year of the first two. So it's like amazing.
Yeah.
We're making progress, and what is great is the dialogue and to work with government agencies to get where we need to. We cannot do this without partnerships.
Of course.
It has to be all of us working to make sure we get there.
Definitely.
But we have to worry though when we have to send patients for radiation. 6 weeks abroad. How do you live in 6 weeks in a foreign country? You don't have an income in your own country. Think about that.
And you're a mother.
And you're a mom, right?
It's exceptionally challenging, mostly because, especially for those patients who they don't speak the language, they have to make provisions for their families back here.
Yeah.
You know, some of them have school-age children, some of them are single parents. And they, again, you have to not only worry about what happens here, but what happens when you're away for 6 weeks. You have to deal with lodging and food and
Yeah,
transportation.
expensive.
And oh, by the way, you might get sick. Something might happen,
And you have
get to be
complications.
hospitalized. And that's another dimension
Yeah.
of those things that you have to be considering.
These are the reasons why it's best to go and do as early as possible.
Prevention.
Now, one of the things I wanted to touch on, because I know we're at a press for time,
Okay.
Breast Cancer Awareness Month, and what is the Belize Cancer Society doing in terms of the awareness for the month?
Our branches across the country, we're doing several things. We have several events planned. For instance, in Dangriga, you have the Dangriga Cancer Society. The Belize Cancer Society, Dangriga, is having a video launch to share awareness about cancer. They also have their candlelight vigil. This morning at 10 o'clock at our own center here at the Belize Cancer Society, we have a photo launch. We have, that's Mrs. Barrow's initiative over the past 4 years. She has gathered a few ladies and given survivors of breast cancer and dressed, and they go on a trip and they do amazing things.
Wow.
And they just keep it to themselves. So I said this year, come on now, y'all are so selfish. Share it with us. Share it with us. So they're showcasing it and launching those pictures, the photo
Beautiful.
shoot this morning.
Yeah.
And then of course we have throughout the month we have activities, candlelight vigils being held in Dangriga. We have in Belize City, and we encourage people to check our program. It's on our Facebook page, and also to remember to stay tuned. The Cancer Society works with, we'll be part of the World Food Day initiative in San Lazaro in Orange Walk. We are doing quite a number of health fairs. There's a UWI health fair as well that we will be participating in, and they want us to focus on breast cancer. We've done requests from numerous presentations. We've done the Red Cross already. We're going to a few high schools, Sadie Vernon and a few others. And of course, there are health fairs being conducted, like with the BCS Dangriga. We have Belmopan Group, they're having a variety show. And of course, Cayo, San Ignacio, they're having a big, once they're working with their Rotary groups, and I love when they work with young people. That's my thing. It's because I'm old. I have to lean on them for energy.
I have no comment there.
I have to lean on my young people to energy, because they're going to rescue me and put me into retirement, right? And so they're working with the Rotary for a walk and run event, but they also have a big cancer walk as well for this month. And so we are full of activities. We encourage everybody to check their calendar.
You have a forum as well on the 26th, I see. Let's Talk Breast Cancer.
Yes, and we're excited about that. We're working with the clinicians. We want to talk. What we want to talk about? We want to bring down our shoulders, relax, and let's talk. How do we manage our patients when diagnosed? Many of our patients don't get the right information. Many of our patients are not told that you don't have to go abroad for chemotherapy. You can have chemotherapy. Once people hear the story and see how they can make use of their resources immediately, the stress is relieved. Cancer is a high stress diagnosis.
Of course.
And so and of course, talking about mode treatment, you know, just not getting into details about actual where it is,
What it
how
does
it
to
is,
you.
Yeah.
what it does, what is this, how can we help our patient with who is diagnosed with, how to help them to survive, how to improve the quality of their lives. When you send a patient off, remember that when that patient comes back, that patient needs to be monitored. The patient needs care.
Reconnected.
Reconnect with their primary and physician, because there are lots of residual side effects from chemotherapy and radiotherapy.
That has to be managed.
That has to be managed. So that's the kind of conversation, because those are the gaps we're seeing. And of course, for us, we will continue to work to set up that comprehensive plan. And I'm telling you, poor Dr. Figueroa, we invite him out
That's
to
why
lunch.
he's getting gray.
We invite him out to lunch, but we make him pay. You know? And so
I think he hates to see us coming.
yes, because we're always telling him there's a crisis somewhere and so on. He knows that we mean well, and it's a gap in the healthcare services.
And we
for
have
Belize.
reported multiple stories right here at the station and multiple media houses of persons pleading for assistance, for access to treatment. We know families individually who have had all their financing one person in the family or still paying bills after they pass. So it is a very serious situation. I know one of the insurance companies are now looking into a cancer line, a treatment line as well. That was part of the education earlier this year. So it is important, but what we have to do individually is, one, support the initiatives, but two, make sure we do our checks for ourselves.
This is true.
and we
And
have to
just,
partner.
I just want to say thank you to actually, and they're probably can't believe this, but KHMH has been an exceptional partner, awesome
Amazing.
partner. Dr. Johnson, Lisa Johnson, and Dr. Mungia.
Yes.
They actually facilitate the seeing of our patients, both for symptom management
Yes.
and for initial diagnosis. And Dr. Mungia he is just precious. Yeah,
Wow.
too bad I can't adopt him.
We have Heather at the office. She walks over there and anywhere. So we just love working with the KHMH, because that's our hospital. We have to
And
work
for
with
people,
them.
and for people who can't make the trip down, maybe are too weak or sick to make the trip down, it's excellent to know that you've built a partnership that they can be able to get treatment here as well.
Are talking too with private sector. There's Mrs. Mada Sylvester's company, and they are interested in supporting the cancer center in establishing a satellite treatment clinic at the Cancer Society's headquarters in Belize City. So many of the patients have to go down to Dangriga Center. So that'll be exciting. We look forward to sharing the details with you.
Yes.
And
Great
we'll have to
job,
bring
man.
Miss Madi on board and let her
Yes.
come and share her vision for us.
Great
And
job.
most
Yes.
importantly, it's breast cancer awareness, so get your checks
Checkup.
done.
Sister, and please, the last Friday, I think, Heather asked me to, please everybody, wear something pink.
Yes.
Please, wear something
me too.
pink.
I will. I will mark it down on my calendar. I'll ask
I want
Heather
to see in your
give
pink
me
shirt.
a reminder.
You even have a pink punch.
Or pink pants.
I even have one.
Whoa, that would be like
Gonna be cotton
amazing.
candy themed for that.
Oh,
It's
that would
almost
be.
close to Halloween too, so it works.
Oh no, I object to that.
But there are also opportunities to get free screening done. I see that in your calendar at
Yes.
Dangriga branch, PSA
Yes.
test, blood. There's a blood drive, pap smears. So do contact or just go to one of the primary care
Of
clinics.
course,
You can
of
be able
course.
to get these services
And at
done.
the BCS, we have support from, I think it's Smart and Belize Healthcare Partners, where we have some coupons that we will give out during the month for free mammograms
wow.
based on referrals. So a full breast check. So we'll send out the announcements shortly.
Okay,
All right.
well, thank you for
Wonderful.
joining us. We put the calendar up for a bit. We'll get it on our Facebook site as well, but you can also find Belize Cancer Society on Facebook and be able to get the full list of activities and see what's happening in your area. And also always remember that you can always show support to the Belize Cancer Society and the the Dangriga Cancer Center
Yes.
to be able to help those, because you really never know when it's going to be in your family next. So thank you so much.
Thank you very much for having us.
We're going to go ahead now and take that final break, and when we come back, we'll have a wrap up.